Hi, I'm Dr. Yatish. I'm a senior surgical oncologist with 20 plus years of experience of treating cancer patients in Bangalore. Today, I'll take you through a journey of preoperative preparation that a patient has to follow for a successful elective major surgery. I call them the 11 golden rules of preoperative surgeries. The first and foremost thing that I want my patients to understand is that they should understand what procedure they have to undergo. If the patient has got any doubts, anything that they don't understand, make sure that you write it down in a piece of paper and discuss with your surgeon before you say yes to a surgery. That is the first rule that I want them to follow. The second one is you make sure that whatever medicines or whatever preoperative other medication that you are taking, you discuss it with your doctor or your surgeon and make sure that he knows what you are taking, and then he will advise you about continuation of such medicine or stopping those medicine. And if a surgeon wants those medicine to be stopped, he will instruct you likewise. Or if he wants those medicines to be continued, he will advise you likewise. The third of the golden rules is you have to eat healthy foods. Good amount of proteins, carbs and fat is a must for any patients because anybody require enough amount of calories and proteins in order to withstand any major surgeries. The fourth of these 11 golden rules is you have to boost your activity. Meaning you have to have a good bit of exercise, good bit of physical activity before you undergo any surgeries under the knife. The fifth is strengthen your lungs. Strengthening the lungs entails good amount of deep breathing exercises. If you can't understand what a deep breathing exercise is, you can ask your surgeon and his team will help you out to practice such simple home-based exercises so that your lungs are in optimal health. The sixth one is that if you are a smoker or if you are alcoholic or if you are doing any nicotine addiction, make sure that you stop it well before your surgery is scheduled. Because any kind of tobacco, whether it is smoking, vaping, wet, chewing, is not good for your surgical outcomes. The seventh one is often the most neglected one is to keep up a very good mental health. If you are nervous, if you are anxious, your surgeon and your surgical team will not be able to give you as good a result as they are supposed to. A dab of meditation or some kind of a stretching exercises or some kind of yoga will help you get through your surgery smoothly. The eighth of the golden rules is you keep your physical health in optimum condition, utilize your resources, available resources, so that you get prepped up for surgery. There are various kinds of booklets which are available, which are provided by various hospitals. Make sure that you ask your surgical team to provide them. You can go through in that. Majority of these booklets are in very simple languages and majority of the patients can understand what is written in that. In case of any doubts, get back to your surgical team. They will help you out, overcome your anxiety. The ninth rule is often the most neglected one. You make sure that you have a responsible adult for you to drive you back home after your surgery, because you will not be able to drive yourself home, so that he will drive you down back home safely. And the 10th one is what do you do the night before the surgeries? Just have to relax, take deep breaths, have a good night's sleep, and before you go to sleep, have a good head bath with some kind of an antiseptic soap. Any kind of soaps are good enough for you. And then make sure that you just eat your dinner, wear clean clothes, be in your optimal physical and mental shape, walk into your hospital with clear thoughts, clear mind, and your surgeon will be able to do his job clearly and successfully. The last one on my list is that you show up to your hospital or to your surgical center well before your time, maybe few hours before your scheduled surgery. And if you have any doubts, make sure that you ring up your surgical team and then ask them whatever question you have, because you'll have some signatures to make, you have some paperwork to do before your surgical team takes you up into the operation theater. Next time you are up for any major surgical procedure, just brush up with these 11 golden rules and make sure that you follow them. I'm sure this will help get through your major surgical procedure without any hitches. Thank you.